And I will introduce our next speaker, Dr. Danielle Margalit, who will be speaking about radiation therapy for the treatment of Merkel cell carcinoma. Thanks so much, Danny.
Hey, thank you, Dr. Silk, for the invitation to participate. So I'm a radiation oncologist, and one of my specialties is to treat people who have Merkel cell carcinoma. And I'm going to touch on radiation therapy specifically for Merkel cell cancer, but a lot of this is applicable to other kinds of skin cancers, as I'll talk a little bit about what radiation is and how it works. So, Dr. Cohen discussed this in the beginning, that our goal of treating any kind of cancer is to tailor the best treatment to the patient. And I like this image of a bunch of people surrounding the patient because treatment really is a multidisciplinary process. And what I mean by that is that it requires a team of specialists that work together with the patient to focus on both treating the cancer, but also preserving quality of life and finding that right balance, because each treatment does have a side effect. And I'll speak a little bit about that. So, what is radiation therapy? About half of cancer patients receive radiation therapy at some point in their cancer journey. Radiation is a type of energy that comes in the form of waves. Those are called photons, or little microscopic or submicroscopic particles, and the ones we use are called electrons. And the use of which one we're going to use really depends on the type of cancer and where it's located on the body. So, medical radiation is called ionizing radiation. And this is just a reminder, there's a lot of radiation around us, but a lot of it is non-harmful at all. And these are waves of energy that are very broad, so have a very low frequency. And those are things like radio waves, satellites. But as these waves get narrow and narrower and the frequency increases, they become very powerful. And that is the range of medical radiation. And that is called ionizing radiation. And it's called ionizing radiation because the radiation energy waves, when they hit a material, so when they hit a cell, it causes ions or free radicals to form, which can damage some of the tissue within the cell, specifically the genetic material. So how does radiation kill the cancer cells? As I mentioned, ionizing radiation generates free radicals, which damages the genetic material in the cancer cells, so they die off. And the body then clears out the dead cells, and so the tumor will eventually clear. Now, normal cells are also affected by radiation, but they're better able to repair themselves. And so radiation takes advantage of this differential effect of cancer cells being more sensitive than normal cells to the effects of radiation. And we typically give radiation just about 15 minutes a day, 5 days a week, and sometimes in Merkel cell cancer for as long as 4 to 6 weeks, to give the cancer cells pulses of radiation each day to weaken them and also to minimize side effects. So on a microscopic level, that picture on the left shows the radiation is hitting the tumor cells, which then die off. And on a macroscopic larger level, that looks like a cancer disappearing. So here is a patient who had a Merkel cell cancer on the upper arm, circled it's got this, in this patient, a reddish appearance. Sometimes it looks purplish. And after they had several weeks of radiation therapy and then recovery from the skin reaction that happens, this is a few months later, the cancer has gone with the radiation therapy. So Merkel cell cancer is a type of cancer cell that's very sensitive to radiation. And as I said, the cells die off in the area that's given radiation. Now, there are other types of cancers that are sensitive to radiation, but then there are also some cancer cells that are not as sensitive. And those are cancers that really surgery is the preference. Now, for Merkel cell cancer, surgery, when it is feasible, is typically the first step in therapy. And radiation is usually given after surgery or when the surgery is anticipated to be very extensive, to lead to issues with function, like significant swelling of a limb or substantial effect on appearance or cosmesis. So I'm going to focus on radiation, but I did want to make it clear that typically surgery is the first step, but that decision in a multidisciplinary setting should be made in a team orientation, because in some settings, a patient will just see the surgeon, there will be an extensive surgery, and then they are referred to a radiation oncologist when perhaps in that specific case, the extensive surgery could have been avoided. So optimally, the care of Merkel cell cancer should be multidisciplinary from the get-go. So here's an example. This is a patient who had a Merkel cell cancer right here on their fifth finger. They saw their outside surgeon who recommended an amputation of the finger. They weren't aware that Merkel cell cancers are very sensitive to radiation. The patient came to see us and saw a surgeon as well as radiation oncology, medical oncology, and we recommended radiation. They had a full response, and this is their finger about a year later, which is a good functioning finger. This patient was seen in our center. I saw them together with our head and neck surgeon. And this is a classic example of a Merkel cell cancer. It's purplish and it's raised. And the surgeon was concerned that it would require removal of a large part of the skin tissue. So we recommended together radiation therapy. So this patient had about 6 weeks of radiation. So it's not quick, it's 5 days a week, 15 minutes each treatment. And this was the end of treatment. There was this tanning of the skin and some crusting here, which eventually healed. And so they do have a little scar here in the long run, and the skin color is more natural at this point. This is what it looks like on a PET scan. When patients get staged, as Dr. Silk mentions, we get a PET scan. And the tumor, this corresponds to the cheek. It's a different view of the patient, but the tumor is bright yellow. And after treatment, when we get a new set of scans about 3 months after treatment, we want that to go away. And in this patient, it did. So when do we recommend radiation therapy for Merkel cell cancer? As I said, we usually recommend it after the surgery has removed the tumor. There's a few exceptions if the tumor is incredibly small and doesn't have any worrisome features. But in most cases, we do give radiation after surgery. We give radiation when the cancer has spread to lymph nodes, again, to get rid of any little potential cancer cells that could still be left behind with surgery, or when surgery will be too extensive or take a long time to heal. Because another thing we try to avoid is to have surgery and then the patient having a lengthy healing process, which allows the cancer cells to possibly grow back. So we want to have surgery and then move on to radiation in a timely manner, optimally within 6 weeks of treatment with surgery. We also give radiation when the cancer is causing a symptom like pain or swelling. If the tumor is pushing on a nerve or on the spine and causing pain, that's a situation where we give radiation to get rid of the cancer cells. Here's an example of an eyelid Merkel cell cancer. This would be a hard area to resect. And so the patient was treated with radiation with a special eye shield that protects the eyeball from the radiation. And this is what it looks like now. There's still a bit of pinkish blush to the eyelid, but there was no cancer and the patient had good vision. Here's an example of a PET scan where the cancer had spread to the lymph nodes. And in this case, the surgeon explained to the patient that surgery was possible, but they were worried that they may not be able to get it all and that it would take a long time to potentially to heal. And this is, you can see there's some areas that are normally yellow on a PET scan, like the brain, the heart, and the bladder. But you can see these lumps of cancer in the armpit. And after radiation therapy, we see that there was what we call a complete response to the radiation. Now, radiation has to be carefully designed. I've showed you Merkel cell tumors in various parts of the body. And so we have to tailor the treatment to each patient and each tumor. And that's true for any kind of cancer. We have to tailor the treatment to the cancer and really try limit side effects. So the first step is we have to take a special scan of the area that we're going to treat. This is a CAT scanner, and we do a CAT scan of the patient in the position they're going to be in during treatment. Sometimes that involves making a few little tattoo dots on the body or making a special plastic mask to keep the head nice and still and safe during the radiation. Once we have the images, we do the computer work. And that involves the doctor drawing the areas we need to treat and avoid. And that can take many hours of work. So here's one fairly simple example of someone who needed treatment to lymph nodes in their groin and their pelvis for Merkel cell cancer. And we have a list of structures. So in this case, I had to draw the kidneys, the bladder, the prostate, the genitalia, the bones, so that we know when we use the computer to design the treatment, how we're going to tell the computer to avoid these areas. Then there's the planning and design phase where we decide how to shape the beams from multiple angles to target what we want to treat and minimize the radiation to the other areas. Then there's the last step of quality assurance, which are multiple layers of quality assurance to make sure that what we plan on the computer is coming out of the treatment machine in real life. So this whole process takes about 1 to 2 weeks. That's why radiation typically cannot start a day or two later after meeting the doctor. And when it's time for treatment, the patient lies on a table, and unfortunately is fairly hard. And the radiation is given with a machine called a linear accelerator, or a LINAC, which is this large machine that moves around, and the radiation comes out of the head of the machine. Lots of beamlets that are shaped as they move around to treat the target area and minimize dose to the normal tissue. Now, there are side effects of treatment, and these depend on the area that is getting treatment. So if getting treatment to the head and neck area, we're not going to be getting radiation to the stomach, getting nauseated, or when treated to the pelvic area or another area, we're not going to lose hair on the face. We're not going to get a dry mouth. Now, side effects depend on the number of treatments. So we try minimize the amount of treatments people get. So if people have had surgery, we know that when you add radiation on top of surgery, it does increase side effects. So here's a typical example when we treat lymph node areas. Here's a patient who had surgery to remove lymph nodes from the groin area, and they then needed radiation afterwards. And this resulted, both of these therapies together, in some swelling in the right leg. Now, this person was able to function highly and play sports, but they needed physical therapy to help with the flow of the lymph from the leg and to wear a compression stocking. Here's somebody who had very advanced Merkel tumors on the arm. So this is the elbow. It was too advanced to treat with surgery, but radiation did get rid of the tumors, but there was a lot of skin reaction. So the typical side effect is skin redness and peeling with some tiredness. And there are also long-term side effects. So once the healing happens, months or years later, there can be stiffness of the elbow, stiffness of the skin, and some of the swelling that I showed you. This individual who had radiation near the mouth area developed a skin reaction that healed, temporary taste loss and dry mouth. But in the long term, they did notice dry mouth and had to have more regular dental cleanings and some neck stiffness and some permanent hair loss in this area. So I hope I've showed you that radiation, together with surgery, and you'll learn next about immunotherapy and medications, all three are important to treat Merkel cell and other cancers. The goal of radiation is to treat the cancer and minimize the impact of treatment on somebody, but it has to be done very carefully, as I showed you, and optimally by an experienced team that knows quite a bit about the cancer and also treating the part of the body. So I'll stop there, and I know there's going to be questions in the discussion afterward.